day everyone, my name is Maxina Ramonic P. Ramos from BSN1B and this is my return demo about vital signs. First, we should assess any clinical signs and symptoms affecting the vital sign, and then cite most appropriate for measurement of vital sign. Factors that may alter the vital sign. We should assess the skin and mucous membrane color, position appropriate for procedure, activity tolerance, chest pain, dyspnea, signs and symptoms of hypertension and hypotension, factors affecting blood pressure. We should determine the policies and procedures for the facility, the client's record for medication that may increase or decrease the vital sign. Good day, ma'am. My name is Maxine Ira Monique P. Ramos. I am from College of Nursing. I am going to be your student nurse for today. May I know your name, age, and birthday?
I'm Kim Princess Ramos. I'm 19 years old. My birthday is January 8, 2002.
Okay. Uh, Today we are going to check your blood pressure, your temperature, your pulse, and respiratory rate so we can record your vital signs. Is that okay with you? Okay. For checking the temperature of the client, first is clean the thermometer tip to body, place the thermometer to appropriate root site, wait the appropriate amount of time. If you are using an electronic and tympanic thermometer will indicate the reading is completely through a light or tone. Remove the thermometer and discard the cover of or wipe with a tissue or a cotton, body to tip. Read the temperature. If the temperature is obviously too high, too low, or consistent with the client's condition, recheck it with a thermometer known to be
36
functioning properly.
Celsius. Normal temperature.
In checking the pulse, select the pulse point, palpate the pulse, place 2 or 3 middle fingertips lightly squarely above the pulse point. If taking a client's pulse for the first time when obtaining baseline data or the pulse is irregular, count for a full minute. Assess the pulse rhythm and volume for respiration. Observe and palpate and count the respiratory rate. If you anticipate the client's awareness of respiratory assessment, place hand against the client's chest to feel the chest movements with breathing, or place the client's arm across the chest and observe the chest movements while supposedly taking the radial pulse. And then count the respiratory rate for 60 seconds and inhalation and exhalation. Count as one respiration. Observe the depth, rhythm, and character of respiration. And then for checking the blood pressure, the adult client should be sitting unless otherwise specified. Both feet should be flat on the floor. The elbow should be flexed with the palm of the hand facing up and forearm supported at the heart level. Expose the upper arm and then wrap the deflated cuff eventually around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cup approximately 2 to 5 centimeters above the antecubital space. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Close the valve of the pump by turning the knob clockwise. Pump up the cuff until you no longer feel the brachial pulse at the pressure. The blood cannot flow through the artery. Uh, Release the pressure completely in the cuff and wait 1 to 2 minutes before taking further measurements. Position the stethoscope appropriately. Cleanse the earpiece with alcohol or recommended disinfectant. Insert the ear attachment of the stethoscope in your ear so that they tilt slightly forward. Ensure that the stethoscope hang freely from the ears to the diaphragm. Place the bell side of the amplifier of the stethoscope over the brachial pulse. Hold the diaphragm with the thumb and index finger. Auscultate the client's blood pressure. Pump up the cuff until the sphygmomanometer reads 30 above the point where the brachial pulse disappears. Release the valve on the cuff carefully so that the pressure decreases at the rate of millimeter per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. When the device has determined the blood pressure reading, note the digital results. Remove the cuff, wipe the cuff with an approved disinfection. In evaluating and documentation, document the data you get, the temperature, pulse, respiratory rate, and blood pressure. Report abnormal results to the primary care provider, and then document the procedure in the client's record.